everyone. And it looks like you guys are ready to go. So let's officially kick off our Maxicare Wellness Fridays. Welcome to Maxi Life Wellness Fridays featuring Defying Dengue. Again, I'm your host, Patricia Bermudez Quizon. According to the Department of Health, June is Dengue Awareness Month. So today we will get to know more about dengue, one of the deadliest diseases in the country. This session will provide insights on the transmission, prevention, and treatment, including knowing when in-care hospital or in-hospital care is needed. Now it's time to meet our speaker. She is currently an associate active consultant at Makati Medical Center and an active consultant in the section of infectious diseases at Asian Hospital and Medical Center. She's also a part-time consultant in the Medical Resource and Research Group at Maxicare and an assistant training officer in the Infectious Diseases Fellowship Program in Makati Medical Center. On top of all of these, she is the chair of the Committee for Health Education and Community Projects in the Philippine Society for Microbiology and Infectious Diseases. And we are so happy to have her here to help us defy dengue. Let us all welcome Dr. Marian Priscilla Quek.
Hello, Miss Pat. Thank you for the kind introduction. And I'm glad to be here today. It's pleasantly surprising to be asked to talk about something else other than COVID, no, which is a pressing topic since last year. So I will be sharing my slides now, if it will be all right with the group already.
Yes, please go ahead. Actually, I was going to say a lot of people are also looking forward to getting information on how the correlation is between the two. So I'm quite excited myself, Dr. Quek, for this talk on defying dengue. So go ahead, take it away. Thanks, Doc.
All right. So again, I'm here to talk about dengue, which is a very timely lecture, especially since we are starting to see the weather change. I would like to show you that, I would like to disclose that I have no conflicts of interest regarding this talk, and I am here lecturing as subject matter expert, and I'm not representing the PSMID during this lecture. So this is the outline of my talk for this evening. So I'll just give you a brief background on dengue, followed by its epidemiology. How is it transmitted? What are the clinical signs and symptoms? How do we manage people with dengue? How can we prevent it? And a little, since we are still in a pandemic, so I'll be talking a little about dengue and COVID-19. So I think most of us are very familiar with dengue. So it's one of the fastest spreading vector-borne disease in the world, endemic in 100 countries. And when we talk of vector-borne, it means that we need an organism, whether it's a mosquito, so for this case, it's a mosquito, to carry the disease to someone else and spread the disease. There are 4 serotypes of the dengue virus. So that's dengue virus 1, 2, 3, and 4. And usually a first infection is often non-severe or even asymptomatic. And in fact, when we do get patients admitted with dengue, they are surprised to see that they have antibodies from dengue, which indicate that they had a previous infection already. And it's commonly known now that the second infection with dengue can cause a more severe disease. There is no cure or treatment in particular for dengue fever, but the disease can be early managed with supportive treatment. So what is the global burden of dengue? So this is a map showing the rates or prevalence of dengue in different countries. So the darker the green color is, the more burden of disease. So this was the Philippines in 2000. There are some more temperate countries. We don't expect to see dengue. This is North America. So we don't see that in 2000. But because of the climate change and global warming, there has been a steady increase in the number of cases. And this is the map of the global burden of dengue in 2017. So you can see that some parts of the world which previously did not have any dengue cases are now seeing dengue. And then in the previous mapping where you have dengue cases, there are a lot more than there was 17 years prior to this, no, or almost 2 decades. So this is important really to emphasize that global warming and climate change does impact our public health. Now in the country, and I think a lot of you would be noticing it, that it seems like our dengue cases have been declining from last year up to the present. So this is a graph from the report from Department of Health, which they report to the World Health Organization. So if you look at the line here, this represents the number of cases of dengue in 2020, and notice the bars in 2021. So when we talk of morbidity week, so the first week is January 1 to 7 and so on. So this report is until March of 2021. And you can see that the number of cases of dengue has decreased from 2020. Now, does that mean that the burden of illness has been decreasing? Not necessarily. We do know that in the pandemic setting, there are a lot of people who are hesitant to seek medical care. And I think they're out there, but they're probably underreported. Okay, so how is dengue transmitted? So the most common mode of transmission of dengue, as we know, is from the bite of an infected Aedes species mosquito. So it can either be Aedes aegypti or Aedes albopicus. And they usually lay their eggs near standing water like buckets, animal dishes, yung food bowls of our pets, vases, and other common areas are the air conditions, the one that catch the water from our air conditioning systems, even our in areas for those of us who have a lot of plants, yung mga plantita dyan, there are certain plant species that are capable of storing water, usually yung mga palm, so they can also lay their eggs there. And these mosquitoes, they prefer to bite people, and they actually live both indoors and outdoors near us. So while they have peak biting periods early morning and evening before sunset, and while we see seasonal variation, generally dengue fever is here all year round because the vectors live with us. Now, it's important to note that the Aedes aegypti and Aedes albopicus mosquitoes, these are also the same mosquitoes that spread or carry Zika virus and chikungunya virus. So very important that we also are able to do mosquito control, not only to control the transmission of dengue, but also these other vector-borne diseases. Now, there have been rare reports of dengue being transmitted from mother to child. So a pregnant woman who is infected with dengue can actually pass the virus to her fetus during pregnancy or around the time of birth. And to date, there has been one documented report of dengue spread through breast milk. However, no, this is just a negligible risk. So even though you have dengue, breastfeeding mothers are still encouraged to breastfeed, no, even if they are living in areas with high risk for dengue or endemic for dengue. And then there were also rare reports of iatrogenic, meaning from healthcare setting, that a patient was transfused with blood containing the dengue virus. But this was before the time that people were familiar with the virus. So it's not something that we see commonly. So what is the natural course of dengue fever? Dengue basically has 3 phases of illness. So you have your febrile phase, or what we call the fever or viremic phase, followed by critical phase, and then the recovery phase. So if you look at the figure here on the screen, the numbers above represent the days of illness. And usually during the first few days of illness, more often than not, the fever lasts around 2 to 3 days, but it can actually last up to 7 days. And during this time, people present with high-grade fever, can even go as high as 40 degrees centigrade. Now, there are different potential issues depending on which phase of the illness you are in. So when you have very high grade fever, we expect that it is possible for patients to become dehydrated, especially if they're not taking in a lot of fluids. And then we would also be able to see at this time some mild manifestations of illness like rashes on the skin. Now, it's important to monitor warning signs to recognize that the disease is progressing, and I will talk more about the warning signs later. Now, during the time where a patient has fever, this is a good time where you can do your viral studies. And the early detection test that we do for this would be your dengue NS1 test, which tests for the dengue antigen. And you can also do some CBCs to check the blood counts. Now, when we go to the critical phase of illness, usually we see this around 3 days or even shortly after the fever has gone, no? What we call fever lysis or defervescence. And this is often the time that I get a lot of questions from patients saying, why is my platelet getting worse when I'm already feeling better? But because that is really how the disease works, no? The illness actually becomes more critical when the patient has already had or has already passed rather the fever phase. And then after which, during this time in the critical phase, you can have complications like shock, very low blood pressure, or bleeding. And this is later on followed by the recovery phase of illness. So what are the signs and symptoms that we see in dengue? No? So the common symptoms would be headache. In particular to dengue, there are common reports of what we call retroorbital pain or pain behind the eyes. And usually you also have body pains, muscle pains. You can have bone pains. Now, bone and joint pain are very nonspecific symptoms of viral illness. And we also see this in other viral infections, no? And then you can also have a rash. So the rash of dengue is a bit typical in that we would see that mainly most of the skin is red and then there are areas of white. And that is the characteristic rash of dengue. You can also have gastrointestinal symptoms like nausea or vomiting. Now, what are the warning signs? When do you seek medical attention? Now, there was a question earlier in the poll. Now, you would think that, all of them are correct now, but with the current pandemic, I get a lot of patients who would want to be tested for different diseases when they're feeling ill but are reluctant to go to the hospital setting in light of the pandemic. So there are cases where you can just observe at home, but there are instances wherein when you have these, do not hesitate to go to the nearest emergency care facility or healthcare facility near you, because this will signal the possibility of the patient already going into critical phase of illness. So what do you watch out for? So you can have a presentation of stomach pain or tenderness. So it's stated here, they often begin within 24 to 48 hours after fever disappears. So this is often, but not always. So there are those who are having the fever, but when they do have the warning signs, you don't have to wait until you're in the critical phase of illness before you go to the hospital. So they can present with severe stomach pain. When you touch their stomach, it's very tender, and they can also present with persistent vomiting and that they're unable to take in any oral fluid intake, which is very important. As we know, no, I said earlier, there is risk for dehydration. So these patients who are persistently vomiting, unable to drink, unable to eat, they should be in the hospital. Those who have rapid breathing, those with bleeding in the nose or gums, or even in the vomit or stool. And for women, no, for women who have had unscheduled menstrual bleeding, this can actually be a sign of bleeding from dengue already, and this will also warrant in hospital care. And then there are those that feel restless or irritable already. Now, of course, we expect that patients who are sick, feel a little tired. But when we talk about restlessness and irritability, these are the patients where they have already changes in their mental status or changes in their consciousness. So it's difficult for you to wake them up, for example. So these are warning signs requiring you to go to the hospital. Now, I mentioned already these signs or symptoms, but there are also, aside from the symptoms, I mentioned laboratory parameters that will tell us that you have to be admitted for dengue. So this would include a laboratory test showing a blood count with a very, very high hematocrit. So the hematocrit is the concentration, reflects the concentration of fluid in your blood. The higher the number, it means that there is already fluid leakage already. And this is an indicator of severe dengue or warning sign of dengue. And also those with very low platelets. So there is no real, it's not really specified the level of the platelet that we would say that it's critical. But as a general rule, if it's less than 100, that's something we have to watch out for. Or if there is a sudden drop, let's say you have a normal platelet at 400, suddenly became 120 while that's still normal, it could also signal the possibility of going into more severe illness. And then we also see sometimes for more severe cases of dengue, inflammation of the liver, and this is seen, sorry, I accidentally pressed, okay. So when you have inflammation of the liver, you can have your liver enzymes, your SGPT or SGOT test, if you're familiar with that, showing you markedly elevated blood levels. And then of course, we do expect sometimes electrolyte imbalances. There are patients who have very high creatinine because they are very dehydrated. And how do we diagnose dengue? So first and foremost, we do a CBC. And then I mentioned earlier the dengue test, so dengue specific test. So this can be a dengue antigen test, which is ideally done early. Now, there are some patients who are clinically compatible with dengue fever, but when you do the test, the dengue antigen test turns out to be negative. So the sensitivity of the test, of this particular test rather, will actually be less in people with a prior history of dengue infection. And then you can also do your dengue antibody test if the patient is coming in later on in the disease course. So this is what we call the dengue IgG and dengue IgM studies. And there are also facilities that are able to do molecular studies for dengue PCR. So how do we manage this patient? So first we have to determine to which group does this patient belong to. So they are categorized into three groups. So the first group is group A, and these are the patients who can be sent home. So how do we say whether this patient can be sent home or not? So I'm sure some of you may have experienced going to the ER. They find out you have dengue, and then you are sent home by the emergency room doctor saying you can still be managed at home. So how do they know this? So these people are the ones who can tolerate enough volume of oral fluids. They are able to pass urine every 6 hours. So what has urine got to do with it? So the passing of urine indicates that your hydration status is good. No? If you're not passing urine for 1 day, then that's already a warning sign. Also, if you do not have any of the warning signs that I mentioned earlier, then they can also send you home. And if they did already blood work for you, like a complete blood count, if you have a stable hematocrit, then they can also tell you to continue home care for dengue. So how do we manage these patients in group A? So we make sure they get a lot of rest. I saw in the video you showed earlier, the doctor telling the patient, first you have to get a lot of rest. And this is very important because our body heals itself when we are sleeping. You give them plenty of fluids to drink. It can be water, or it can be electrolyte solution or juices. And you have them rest and sleep under a net, a mosquito net, and have them wear a repellent. So why is this important in a home care setting? We mentioned earlier that the transmission is through the bite of a mosquito. Now, if someone is having fever, usually this is the time when the virus is actively circulating in the blood. So someone with dengue who is having fever now, if they get bit by a mosquito during this time, this mosquito can now bite another person and potentially transmit the dengue in the household. So I also get asked by patients, will I get dengue from, let's say, from my husband, no? If I am sleeping in the room with him. So the answer to that is not directly, but of course, if you are together and there are mosquitoes in your room, then the risk of you getting infected because of a mosquito bite increases. We also manage these patients with paracetamol to address the fever, some pain relievers for headaches. Now, I'm sure you've heard that we try to avoid using some forms of anti-inflammatory agents, like mefenamic acid, ibuprofen. So these are what we call NSAIDs, non-steroidal anti-inflammatory agents, and they have the possibility to cause gastrointestinal bleeding. That's why it's something that we avoid in dengue. And then also, again, it's important to familiarize and learn the warning signs of severe dengue. Once they have it, then you have to bring them to the hospital right away. Now, there is what we call the group B. So these are the ones that should be in the hospital management. And medyo paulit-ulit, no? But this is something that I would like to emphasize. People coming in with warning signs should be brought to the hospital. But not everybody requires a warning sign to be admitted. For example, there are socio-economic indicators or social circumstances that make it harder for some patients to access care. So let's say this patient is alone, or this is an elderly far from a healthcare facility. They have no reliable means of transportation. So these patients, even if they don't have warning signs yet, may also be admitted so that they can be closely monitored inpatient. And also, if you were brought into a primary care facility that doesn't have the means to manage dengue with warning signs, then this is also the group that is transferred to the hospital. And how do we manage these patients? So I mentioned earlier, there's no cure for dengue fever. We just give them supportive treatment. So these supportive treatment can be in the form of pain relievers, fever medications. If patients have nausea or vomiting, we give them medicines to address those symptoms. And very important is IV fluid replacement. Remember, in the warning signs, the inability to take in oral fluids is one of the reasons we admit. So IV fluid replacement is first and foremost in our management among these cases. Now, these group C, these are the ones with severe dengue, and they not only require inpatient care, but they need emergency treatment and urgent referral. So these are the patients coming into the hospital with shock, low blood pressure. They could have accumulation of fluid elsewhere, like their lungs, for example. They can be bleeding heavily, and they should be admitted in the hospital within 24 hours. They are usually admitted in the ICU, especially for more unstable ones. So aside from the symptom relief and IV fluids, those with frank bleeding undergo transfusion. Now, the recommended transfusion if you have acute bleeding will often be the whole blood or red cells. But in some with profuse bleeding, we give platelet just to stem the bleeding. And then, of course, we would need critical care supportive therapy. So if you have low blood pressure, we give medicines to bring them up. If your kidneys are failing because of the severe dehydration and fluid leakage, then you might need what we call renal replacement therapy or dialysis. And then we have to correct electrolyte imbalances. And for those who are on the other end of the spectrum of dehydration, which is those who are already loaded with fluids, we give them diuretics as well. Now, I'll just briefly touch on commonly used home remedies that I always get asked in the hospital. So I'm not sure if you are familiar with this plant. This is Euphorbia hirta, commonly known as tawa-tawa or gatas-gatas. And this was purported to be supposedly a medicine that can bring up your platelet count. And what was the basis for this? No, there was a UST study in 2012. This was an animal study, so they did this in rats. They induced low platelet in these rats using some medicines. And they found that those that were given the tawa-tawa actually had 47% increase in platelet count, a decrease in the bleeding time, and the clotting time also is has changed, no? Now, these are animal studies. So, what about the data for humans? So, there has not been any clinical trial that involved humans yet. In fact, in this article, this is a systematic review of the scientific evidence for tawa-tawa. So they noted that very few studies have been done, and it is recommended by this study that more information is needed on the pharmacologic approaches in terms of what is the active compound in this plant, no, that's supposed to be causing this benefit, and what is the mode of action of this active compound, if any, in the tawa-tawa to be able to address dengue. So there are no double-blind clinical trials to reevaluate the efficacy and safety of this drug. So in essence, there is no information yet to strongly recommend this as something that we should include in our standard of care. Now, when I do get asked by patients, no, can I drink it? So I just tell them that, well, there's no evidence that there is actual benefit, but if it doesn't harm you and you're drinking it on a regular basis, then I don't see any reason not to allow it because there have been no data on toxicity of this plant. Now, there are other traditional remedies. So this leaf on the left is papaya leaf, and the one on the right is malunggay. So these have also been purported to be a cure for dengue. So let's look at the evidence for this. So I saw a systematic review and meta-analysis on the papaya extract. So Carica papaya is the scientific name. They noted that there were no serious adverse events noted in those that took the papaya extract. They saw 3 different studies that looked at the effect of papaya in dengue. They saw that it was able to reduce the duration of hospital stay by around 1.9 days. However, the evidence was very low quality and only few participants. And they also looked at its effect on the platelet count between the first and fifth day of illness. So they looked at 3 studies, but again, very few participants and low quality evidence. So at this time, there was no evidence available regarding any clinical outcomes. So the clinical outcomes that they are referring to are, did people not, did we prevent death from dengue? So these are some of the clinical outcomes. Did we prevent any serious manifestation of dengue or plasma leakage? So all of these, there was no information that they gathered other than these hospitalization and platelet count. So what is the evidence for this? It is not recommended as standard of care. But again, pag tinatanong ako, I just let them take it if they want to take it. Now, for the reason that there is no harm naman, and I think the placebo effect is also very powerful. Okay. Now, let's go to the thrombocyte, the efficacy. So, saan ba nanggaling yung mga tawa-tawa, papaya, malunggay? I mean, who thought of that? So this was actually investigated because people have been using this, the people in the provinces. It's part of their folkloric or traditional medicine. So there was a group of pharmacists and nurses who investigated the use of these in animals, and they have found that they need to have deeper investigation to determine the activity of these plants to be able to increase the platelet count. Okay. Now, what with regards to supplements naman, so one of the common supplements that are being given are your zinc, no? In fact, even in current viral infections, it's part of the usual supplements that are being taken. So what is the evidence for this? I just found a study more on children, and this is a Thai study wherein they found that a lot of children actually have deficiency in zinc, and they saw that supplementation with zinc can reduce the dengue fever duration and limit hospitalization. But the advantages of supplementing zinc are mainly to address the deficiency. But other than that, there are no other significant advantages. aside from providing the normal serum zinc levels for people to be able to fight off infection. Now let's go now to prevention and control. So since we know how the dengue virus is transmitted, which is from the mosquito, a lot of the interventions to counter dengue and prevent its spread and in the community is to address the mosquito, or what we call vector control. So this is the 4S contra dengue by DOH. It has been a long running campaign. So S stands for search and destroy. You search and destroy for breeding sites of mosquito, breeding grounds, and you have to clean your surroundings, dispose unusable items that seem to be collecting water. The other S is self-protection measures. So you wear long sleeves or yung long pants, long sleeve shirt, use a mosquito repellent to be able to avoid getting bit by mosquitoes. Seek early consultation, especially if there's a need for consult with the clinic, even the teleclinic. So I saw earlier there was an ad on being able to consult your doctor through telemedicine. So that's also an important part in prevention and control of dengue. And then support spraying or fogging, especially if there is an outbreak in the community of dengue. Now, another means of prevention, this is very controversial, especially in our country, is the dengue vaccine. So the dengue vaccine was previously available in our country. It was pulled out, but this is a live attenuated vaccine. So when we say it's live attenuated, it means that the vaccine is made up of a weakened but live virus capable of causing infection if your immune system is not good. And this is available still in some countries for people aged 9 to 45. Now, there is a warning to give this to persons with confirmed prior dengue virus infection because, as I mentioned earlier, getting a second infection of dengue is a risk for more severe disease. And in fact, the manufacturer of this vaccine in 2017 reiterated that people who receive the vaccine who have not had a prior infection may be at risk of developing severe dengue if they do get dengue after they were vaccinated. Now, we are currently in a pandemic situation. And of course, this is a double burden of disease for our country. So the combined impact of COVID-19 and dengue epidemics can result in devastating consequences on the populations at risk. And the Philippines is an endemic country for dengue. So we have to be able to control these infections, no, and also the vectors, which are something that we can manage. And it's important to note that since we are in a pandemic setting, someone coming in with fever in the healthcare facility, one of the differentials would still be COVID, but we also have to consider dengue as it is endemic in our country because sometimes nakakalimutan na yung i-request. And co-infection with both dengue and COVID are actually possible. So this is just a table differentiating the two. So we know that they have different viruses. One is caused by dengue virus, the other is the SARS coronavirus 2. Transmission is different. So dengue is transmitted through mosquitoes, while COVID is transmitted from person to person through respiratory droplets. The incubation period of dengue can be anywhere from 3 to 10 days with a median time of 5 to 7 days. For COVID, the incubation on the average is around 4 to 5 days, but maybe as long as 2 weeks. So both of them present with fever, body aches, and can have symptoms ranging from mild to severe. For mild symptoms in dengue, the usual that we see is the headache with eye pain, rash, vomiting. For those with COVID, more of respiratory. So you have your sore throat, congestion or runny nose, loss of taste or smell, cough, diarrhea, in addition to the fever, body aches I mentioned earlier. So what are the signs of severe disease? Someone with severe dengue will more often present with shock or bleeding, while those with severe COVID-19 will present with difficulty of breathing with a low oxygen saturation and respiratory failure. There are those who actually come in with shock also. Now, what is your risk factor for severe dengue? Usually, this is seen in infants, those with previous dengue infections, and those with chronic medical diseases, whereas COVID-19 is, with severe COVID-19 is seen more in the elderly, ages more than 65, those with chronic medical conditions, and those residing in the nursing home, mainly because of the setup. No? Now, for protection 4S. What is 4S? I mentioned earlier, search and destroy, seek, consult, self-protection, and also your um, tawag dito, your supporting of your fumigation in outbreak settings. Whereas for COVID, it's dapat maintain air circulation, physical distancing, wear mask and face shield always, and also limit your time to less than 30 minutes if you are unmasked. And then vaccines are available for both. For dengue, you take the vaccine if you've had a previous infection, but this is moot point since it's not available right now. And for those for COVID, the vaccines, yes, if you are eligible for the vaccine. So take-home points. Dengue is endemic to the Philippines and it's transmitted mainly through the bite of the Aedes mosquito. Not all infected with dengue would need hospitalization, and we have to be familiar with warning signs for timely intervention and in-hospital care. There is no proven treatment for dengue other than supportive management. Prevention is mainly through vector control, and there is a double burden of COVID and dengue in this current pandemic situation. That's the end of my slide. Thank you very much for listening.
Thank you also, Dr. Marian. Actually, the information that we gain from this talk is really important, no? Especially for every household because we do live in a tropical country and June being Dengue Awareness Month, it's really important for us to be able to hear this from an expert like you. Thank you so much, Doc Marian. We'll hear from you again in just a short while. Alam ko, ang dami yung questions. Ako rin mismo, as someone who has three children, who's very active and everything. I also have a lot of questions too. Kaya naman, you guys can continue to send in your questions right now as we take a look at those questions and of course give way for our moderator who will facilitate this Q&A. Today's moderator is a diplomat of the Pediatric Infectious Disease Society of the Philippines and an infectious disease consultant at the Makati Medical Center. She is a medical specialist level 3 for the Research Institute for Tropical Medicine. And she returns on our Maxicare Wellness Friday stage. And it's always a pleasure to have her with us, Dr. Nicole Ferreras. Doc Nicole.
Hi, good evening. Thank you for having me again. Nice to see you, Miss Pat.
It's always great to have you. I mean, best of luck with the questions because a lot of these questions are really, really specific and spot on. So go ahead, Doc Nicole, tell us what you think and go ahead with the questions.
Hi, Doc Marion. Thanks
Hello.
for thanks for such a good, relatable, and easy to understand talk. But of course, there are still some questions, no, some things that some of our participants want a little clarification on. But before we start, one of our participants wants to know, though I know you mentioned this a bit earlier na, Um, now that we're in the middle of COVID, the COVID response, the surges, and all that, what's the true incidence ba of dengue? Like, are we seeing more cases now, less cases? Is it all COVID? I mean, what do you have to say about that?
Yeah, so I presented a slide earlier. I don't know if baka they logged in lang late. There was a decrease in the cases, but I feel and I really think that this is underreported. But dati kasi no, pre-pandemic, and I'm speaking also from my experience as a clinician, a lot of people, when they get fever, immediately go to ER, get a dengue test. That's because that's the usual thing that we do. And we do get higher diagnosis of COVID, and also mainly because people are seeking care. So I think right now they're still there. In fact, I do have patients who have dengue alone. Pero right now nga, like I said, it's refreshing to be asked to talk about dengue kasi nga it's puro COVID na nga lang. But we do get our sporadic dengue admissions, and I would admit even in our hospital census, for the two hospitals I'm with, very low cases of dengue. Although it was summer, the past few months it was very hot. So we'll see now in the rainy seasons, they might pop up again.
Pero walang ligtas, Doc, kasi
Now,
may
I saw a question also, Nicole, na yung the true numbers. So, the report that I presented from DOH was until March 27. So, wala pa silang na-report. In fact, in the WHO site, they said, no report from March to present. So, I think baka lang they're not really focusing at this point with the dengue and more on the COVID response. But that's just my opinion. I'm not the DOH, so I can't really say.
Okay, so Doc, some a little bit lang about the disease, no? Because I know you mentioned that there are four serotypes, and ideally you can get dengue four times. But one of our participants wants to know how come, or what's the concept behind like the second or third dengue becoming worse? Kasi daw in their family, the first time one of their members got dengue, he or she was admitted. But the next two times, hindi na daw. Parang at home na lang. So, can you explain a little bit more about that concept?
All right. So there are two things. One is it is likely that the first dengue infection was actually a second, because a lot of times people who have had a primary dengue infection do not even have symptoms. So baka hindi lang na-detect or na-test nun, it was probably discounted as sinat lang or flu lang, and it's subsequently resolved, so they didn't have it tested. But that is the more common scenario that we see. However, there's also the thing that there are certain dengue virus types that are more virulent than others. Of course, we don't do serotyping as part of routine clinical care. It's more of an academic exercise for research purposes. But some get infected with another strain that might be even more virulent, so which is why they were probably admitted for the first but not for the second.
This person also wants to ask Doc, no? Parang there's been some talk about blood types and all that. Is there anything, parang if is there a certain blood type that will make you less prone to dengue, or parang more prone to complications, or nothing at all to do with blood type?
Um, Parang wala siyang talagang difference, no? I mean, there are some that are saying that blood type, if I'm not mistaken, B yata or A yung mas delikado daw. But as far as the manifestations are presenting, not really a constant yon. So I do get all sorts of blood types in my patients that have severe dengue. I don't think that's a significant factor.
So nowadays, Doc, di ba, parang remember before, whenever you talk about dengue, the parents or the patients mismo, they always think, oh my gosh, kailangan ng matransfuse. Is that like a wrong concept? Like, because I know some people, once their relative gets admitted for dengue, nagsha-shout out na sa Facebook, we need donors. We need ganyan. So what can you say about that?
Okay. So, a lot are actually marami rin tayo. I'm sure Dr. Nicole, you would agree, no? We do get a lot of instances where your platelet is, kasi the normal platelet count for the reference of everybody is around 150 to 450,000. So there are people coming in 100,000. Doc, are we gonna transfuse na? Minsan 30,000 na lang. Doc, are we going to transfuse na? So, this is something that we do when there is already evidence of bleeding. There is no such thing that is what we call prophylactic transfusion, meaning you give a platelet para hindi na bumaba. Kasi while you are in the critical phase and while the dengue virus is still running its course, anything that you will transfuse will just be destroyed, kumbaga, by the immune response. And if it's going to go down, it's going to go down, no, whether or not you transfuse blood. Also, I'd like to call attention to this phenomenon called transfusion-related acute lung injury, or TRALI, where in fact, transfusing with blood products can also cause harm to the patient receiving the blood products. So this is something as a last resort for us clinicians. There are some sobrang baba na ng platelet, but let's say they are already in the recovery phase of illness. Sometimes we wait it out, no? Kahit na medyo na pressure na kami mag-transfuse. If we know that we are expecting the platelet will be going up already, then sometimes we still forgo transfusion. And then we say it's gonna go up later. And minsan, yun nga, tataas na talaga, even without any intervention.
So Doc, how come so you're saying, 'di ba, you don't give prophylactic nga transfusion. But what about because there's a question here, no, how come sinasabi na, 'di ba, usually pag ibang diseases, once you reach the afebrile phase, no more fever, okay na, that means good response. So how come in dengue, when we say there's no fever, we're not yet parang out of the woods? Why is
You're
that?
not out of the woods yet.
Yeah.
Yeah.
So why is that, Doc? Parang what happens ba during that stage?
Okay, so during the critical phase, yun nga, I mentioned this happens during the first 48 hours after the fever has gone. So part of the immune response, they make your blood vessels leaky, no? Parang they're in our bloodstream kasi in the blood vessels there is fluid which we call plasma, and the cells, no, yung dugo talaga natin, the red cells, white cells, etc. So when you are in the critical phase of dengue, fluid that should be staying inside your blood vessel can leak out of the blood vessel, and then it can cause your blood pressure to drop during this time kasi in essence para kang nawawala ng volume sa katawan. They're not effective because they're not inside the place they're supposed to be, which is inside your blood vessels. And also your immune response will start to target already. Kaya nga may tinatawag tayong antibody. Parang autoimmune type siya na pagbaba ng platelets. So they also destroy the platelets during this period. And this is when we see the drastic drop in the platelet count. So we always advise families, ayan na, wala nang lagnat. Expect nyo na bukas babagsak yung platelet niya. So it's good also to tell them para hindi sila magulat. Kasi nga usually akala talaga, pag wala nang lagnat, tapos na. But actually, this is the time when they should be more often than not admitted.
Mhm. Okay, Doc. So a little bit about long-term effects. Meron bang long-term effects, Doc? Kasi now COVID, we hear a lot of long haulers, extended symptoms, ganyan. But in dengue, are there any such complications?
This is not very common, although there is what we call post-viral infection fatigue syndrome. It's very common also in dengue, but they're usually self-limiting. Very rare that you see that it lasts longer than 2 weeks. But may mga ilan, but not as common as what we see in COVID. There are those who can have cardiac complications from dengue infection like myocarditis. This is something that's also very rare. And we usually would see this around the time when the patient is going into the critical phase of illness. But as far as long-term effects, of course, if you have heart complications from the dengue, then you can expect more long-term symptoms later on, from the heart rather than the dengue itself.
Okay, so Doc, we have a lot of questions then on prevention, no? So of course, when we talk about prevention, hindi talaga maiwasan. Lalabas yung discussion on the vaccine. Do you think as an ID expert, no, and my boss, no, my personal boss in so many hospitals, do you think it's a good decision to bring back the vaccine, or what's your comment na lang on is there an effect on the clinical course or the symptoms of these patients if they receive the vaccine?
Yeah. So this is a special precaution for the dengue vaccine. And I think one of the reasons why there were a lot of issues with it was the fact that when they rolled it out on a massive scale, they were not able to elicit whether these individuals given the vaccine actually had a previous dengue infection. So I think no, it's still endemic. It's still around. It can, for me as an infectious disease physician, and of course one of our advocacies is public health and vaccination. It is still for me, I think, something that we would want to be here with our armamentarium, but we should adhere to the special warning that we have to document first. Did this child, or kasi hanggang age 9 pwede, no? So 9 to 45. So did this person actually get previous dengue already or not? Because if we know for a fact that they did, then we can give the vaccine without having to worry about that more severe dengue. Kasi kung may prior dengue infection na yung taong yon, whether or not they get the vaccine, if they don't get the vaccine, they will get severe dengue anyway. So if you give the vaccine, parang ito na yung second infection niya, infection but not really infection, no? And then you protect them from the third, fourth.
So the more times ba, Doc, that you get dengue, does it get worse and worse? Or parang may immunity ba from dengue? That's one of the questions of our participants. No? Meron bang immunity pag nagkaroon ng dengue?
There is immunity to that strain. So there are 4 strains. So kunyari, ang naka-infect sa'yo nung una was dengue virus 1, although we have no way of knowing kasi we don't test for it. But let's say you got infected with dengue 1, then you're immune to that strain, but there are four. So you can get infected with the other three at a later point. But for the viruses that infected you, lifetime na siya na protected ka from that strain. Now, yung unique kasi sa dengue is what we call antibody-dependent enhancement. Meaning you have a more exaggerated immune response the next time that you are exposed to this organism. Parang kumbaga sa immune system, kung iisipin mo sundalo sila, yung immune system mo, parang PTSD na siya. So they exage yung kanyang immune response to the second exposure to this offending agent. Kaya maraming natatamaan. So that's a rough analogy, not exactly, but parang ganon.
So we have medyo, I know a lot of people are touching na on the vaccine medyo, but I think it's fair naman to discuss because right now there's a lot of discussions, Doc, di ba, on vaccination and the COVID vaccine. Do you think that now that the COVID vaccine is so essential, people will be more open-minded about vaccines in general? I mean, I'm not talking about the dengue vaccine, but do you think this has opened the discussion for vaccination in general?
Yeah. It worked both ways, no? So right now, I actually talk sometimes for, I lecture on the COVID vaccines as well. So while we're on the topic of vaccines, and of course, what happened with the dengue vaccine previously did not help the vaccination efforts. So there's a lot of vaccine hesitancy. Even some doctors, surprisingly, are, there are a few of them, not all, but very few that are also a bit resistant to getting vaccines. And one of the reasons for vaccine hesitancy is the fact that people perceive that the risk from the vaccine is higher than the risk of getting the disease. So it's always important to try and talk and connect with these people, find out what's the reason why they don't want to get vaccinated, and address their concerns. So I think it's a good time to bring vaccines in the foray of discussion again. But there will be challenges. Even up to now, we see a lot of challenges trying to get people to be vaccinated against COVID. COVID nga, worldwide na yan, pandemic. This one is just limited to a few countries, di ba, yung dengue. So even with COVID, where more than 3 million people have died already worldwide, still we have people hesitant to get vaccinated. How much more for dengue na parang sa tropical countries lang siya madalas nakikita. So medyo mahirap mag-convince talaga. But it's a good time. Yeah.
So a bit more, Doc, on prevention, no, because we've been talking about the vaccine. So now that we've been on lockdown, a lot of pools have not been maintained. So this is one of the questions of our listeners, no. Do you think a swimming pool is a breeding ground for mosquitoes? So I guess a little talk about the vectors here.
Okay. Yeah. The vector would lay eggs in clean water. So if treated kasi yung pool, so kunyari meron siyang chemicals doon, it's not really conducive for the mosquito to lay their eggs there. So in fact, one of the interventions nga that was being done before was to treat the stagnant water. Kaya lang may mga environmental concerns din. So that's no longer being done. But they used to do that, put chemicals in the water so that the mosquito doesn't lay eggs there. Of course, it's also good na kung wala naman ding gagamit, also from a maintenance perspective, edi i-drain out na lang muna yung pool kung wala namang gagamit. But if may chemicals yon, I don't think that the mosquito will breed there.
Okay, so Doc, we have so many questions, but unfortunately we're short on time. So we have just a few more questions. A little bit naman, Doc, sa treatment, no? So we've talked about prevention, we've talked about the signs and symptoms. Can you talk a little bit, Doc, about a few years ago, there was a recommended anti-malarial drug that was being marketed for, or that was being recommended for dengue as well. Do you think that that will still work in our setting? Yung artemisinin? Do you think that is
Artemisinin,
yeah.
hindi pa natin siya ina-advise. I think also even our supplies of that is talagang specific for its use in malaria. And we already have good data from our experience as a country that even in the absence of these treatment modalities, fatalities of dengue, people with dengue are actually low. No, case fatalities are low, but of course, given the burden of illness, syempre, that will still amount to a significant number. But they resolve kasi it's self-limiting eh. So it's not something that we are including in our standard of care at this time. Maybe we need to know and get more info on that drug for its use in this context.
Okay, so it's been such a nice time with you, Doc, and I wish we could have more time with you so we can discuss a lot more about dengue. But unfortunately, this is our last question. But I enjoyed your talk so much. No, parang it's nice, nice break din from COVID. Kahit na walang takas, meron pa rin co-infection ng COVID and dengue. But at least a little shift in the discussion, something new for our listeners. So I'll turn back over to Miss Pat. Nice seeing you, Doc, and I hope everybody enjoyed your talk as much as I did.
I did
Thank
too.
you.
Actually, Doc Nicole, I really enjoyed it. So I really appreciate you both. Dr. Queck and Doc Nicole, if possible. Of course, this discussion has been wonderful and we really appreciate it. But before we let both of you go, and I'll start with Doc Nicole on this one. Doc Nicole, maybe you can share a final message for all of our Maxicare members here. This being, of course, Dengue Awareness Month, and just your final thoughts on this.
I guess my what I wanted to say is, COVID is present, it's all around us, but hindi pa tapos ang laban, meron ding mga ibang diseases. So it's nice that this comes back into awareness. There's a way to prevent it. So just remember, COVID will pass, but we'll still be left with some more endemic infections in the Philippines.
I like that message. Thanks so much for that, Doc Nicole. We appreciate you. And thank you so much also, Dr. Queck. Wonderful lecture. It's really great for all of us to understand it better. But your message, please, would be appreciated by our MaxCare members.
Okay, so I'd just like to emphasize, as mentioned, we still have our tropical diseases to contend with. They're still there. And now that it's raining, try and look at your village or in your household. It's a community effort. Make sure that your surroundings are clean and there are no breeding grounds for mosquitoes to decrease the risk of COVID tuloy dengue.
That is a great reminder from both of you. We appreciate you and thank you so much. Well, that was such a valuable experience for all of our Maxicare members today and to our attendees. Thank you so much for participating in the Q&A and being so engaged throughout this event. I feel like we're really doing a great service, right, to our country by discussing this. So make sure you guys share all the information that you got here to your family members, your loved ones, and your friends. And don't forget to use our hashtags, which I will share with you guys later on. And of course, we would like to invite you guys to please take a few moments to answer a feedback form after this event. Let's show the screens on the screens right now. Here's our QR code, and we are also posting the link to that on our chat. So make sure you do take a few moments treatment, and of course, taking care of the lungs and also diabetes. We hear you and we appreciate the time that you spent to fill out our poll questions. Now, if you enjoyed this experience, please do share it on your social media using our hashtags. Live your best life and the hashtag Maxicare Wellness Fridays. And please do tag Maxicare on Facebook, which is at Maxicare Healthcare Corp. They also have their IG at Maxicare Healthcare. And of course, you should also take a look at Maxicare Health and Wellness when sharing about your wonderful takeaways from this event, particularly on IG. Please do look for them there. And don't forget to subscribe again to their YouTube channel. Look for Maxicare Healthcare Corporation. Now, to learn more about the products of Maxicare, please do visit www.shop.maxicare.com.ph, or you can even send them a message through FB Messenger. If you have questions about the Maxicare Wellness Fridays, you may send an email to maxicarewebinar@maxicare.com Guess what? You guys can set your calendars already for our next event. Let's show them our QR code, and it's going to be with Bo Sanchez. Are you ready to rebound? Well, if you're not, this might be the best event for you to attend. That'll be on June 25 at 6 p.m. and the QR code will help you register. So make sure you guys already take a photo of that QR code so you can go straight to the registration after I'm done. But basically, that ends our event for today. I'm looking forward to seeing you guys again on June 25 at 6 p.m. with Bo Sanchez as we all get ready to rebound. Thank you for being with us this evening. We hope that you enjoyed and you were able to take away meaningful information. Have a great evening. Enjoy your time with the family. Looking forward to the weekend. And we know that with Maxicare, you can live your best life. Bye, guys.